When performing a hair transplant in the crown area, one of the first things that I look at is the coronet. So what is the coronet? It is an area of thinning hair that descends in the midline at the very bottom of the crown. It looks like a small circle, hence the term coronet. It doesn't happen in everyone. Some people, they have a perfectly circular crown, but other people, what looks like a perfectly circular crown, they actually have an extension that goes farther down in the midline that is another zone of thinning and balding called the coronet. The reason why this is such an important area to look for is that this area may then expand the number of grafts that I need to harvest to cover this zone. In addition to that, it may compromise what I can usually harvest with a hair transplant. So in these very advanced cases, the strip procedure is still the better preferred way because there's not enough grafts to cover FUE with FUE. And I'm going to talk about that in how to manage advanced baldness. But of course, if you have a small crown without a coronet, FUE can be a usable technique to do it. But oftentimes with these larger crowns, there's a coronet that dips down, which then compromises what I can harvest from the area safely for transplantation. The reason that is that I don't want to get too close to the coronet with my harvest because I'm worried that coronet expands into the area that I've used to harvest, and then that causes an issue where some of those grafts won't survive. So this is a sophisticated comment. You probably don't even understand entirely what a coronet is, but it is a specific advanced circular patch of hair loss that extends in the midline, the bottom portion, that may A, require a lot more grafts to transplant, and B, compromise what I can harvest. So those are things that I look for when I'm looking at a crown for design. Of course, there's a million other things I'm looking at the crown in terms of waves of miniaturization, age of the patient, degree of size of the crown, which way the whorl pattern goes. Is it more on the vertical scalp, the horizontal scalp? And of course, donor characteristics. There's a million things I'm looking at. Advanced thinning in the front versus the back. But the coronet is the focus of this podcast.